Hi, this is Dr. Joseph Sunny with a medical minute about diverticulosis and diverticulitis. Diverticulosis are little pockets in the colon that can develop from constipation. This occurs when the inner lining of the colon pushes through the colon wall and causes these little pockets to form. There's still some questions about exactly how this develops, but constipation is definitely one factor which can lead to increased pressure and can lead to these outpouchings. In my experience, I've seen diverticulosis in people as young as their 20s, but it becomes more common as you age. The next problem with diverticulosis is that with enough pressure and constipation, you can have a tiny little hole develop inside these pockets, and then you can get an infection. Some people end up going to they get a CAT scan, shows diverticulitis, and then they get sent home with antibiotics. Other people get admitted, they might need IV antibiotics for a couple of days, and then a few more days of oral antibiotics at home. The other thing to consider when you get diverticulitis is how bad the diverticulitis is. In uncomplicated diverticulitis, it's only that small little hole with a small little infection. In complicated diverticulitis, you have a full perforation. There could be air and pus on the CAT scan. It's a more advanced type of diverticulitis. People can sometimes get admitted to the ICU. They can have fevers and chills, and sometimes they need surgery to cut out that area of diverticulitis, or they need interventional radiology to put a drain into that area. But most people just need IV and oral antibiotics to treat diverticulitis, especially when it's uncomplicated. The key thing with diverticulitis is that you need a colonoscopy in 2 months if you haven't had a colonoscopy recently. If you have uncomplicated diverticulitis, the risk of colon cancer is 1%, and if you have complicated diverticulitis, the risk of colon cancer is 10%. So if you've been diagnosed with diverticulitis, schedule an appointment at the clinic to discuss a colonoscopy. If you have any questions about this or other topics, leave a comment below.